Okay. Hello, everyone. It's a great pleasure to be here as a moderator, and we are continuing our comprehensive neuroanatomy educational program webinars. And today we have as a chairperson Professor Aipcherian, the neurosurgeon from India and from Nepal, skull base, vascular, and neurotrauma surgeon. Also today we have Dr. Babar Ali Qurishi, who is going to be our first speaker, MRCS ED, FSPS, neurosurgery, consultant neurosurgeon at the Lilliput University of Medical and Health Science. And Dr. Babar will be talking today about cross-sectional and surface anatomy of the midbrain. And our second speaker will be Dr. Maximiliano Nunes, the staff of neurosurgical department at the Hospital of El Cruce, Buenos Aires, Argentina. And Dr. Maximiliana will be talking about cross-sectional and surface anatomy of the pons. So we can start from our first speaker, Dr. Babar Ali Qurishi. You're welcome.
Hello, good evening, everyone. Am I audible?
Yes, you can start sharing your screen. We can see you and hear you.
Yes,
now is it
perfect.
in full screen?
Yes,
Perfect,
now it's
yes.
full screen. Yeah.
All right, sorry for the delay. I'm really thankful to the Yemeni Society of Neurosurgeons and Pakistan Society of Neurosurgeons who are collaborating for this venture. Especially thank you to Dr. Ahmed Ali Jardi. Am I pronouncing it right? And I'm really
Yes,
thankful to Professor Riaz Ahmed Raja, who have given me this opportunity to speak a little about the anatomy of the midbrain. All right, so as discussed previously, the brainstem, though it's a very small part of the brain, but it consists of very important role in the entire brain functioning. And it is so important that even for the declaration of the death, we assess the brainstem functioning or the brainstem reflexes. So that shows how important this part is. And when we talk about the midbrain again, it's a very small in size, just about 2 centimeter in its vertical axis, but it is a major pathway that connects the forebrain with the hindbrain or with the rest of the brain stem, with the pons, cerebellum, and the medulla oblongata. So, little knowledge about the embryology, as we know that the forebrain part, telencephalon and diencephalon, which will make up the brain cortex and the diencephalon. Then there's the part mesencephalon. So this is the connection between the higher mental structures, the cortex, cerebral cortex, and with the rest of the brain stem, that is with the rhombencephalon, which will develop into the cerebellum and the medulla oblongata and pons. So we'll start it with the outer surfaces of the midbrain. For the ventral surface or the anterior surface, we have to look here. Is my pointer visible on the screen?
Yes, we can see your pointer.
All right, so this is the ventral surface. Let's start it from the this is the major portion of pons, medulla oblongata, and just above it there's the portion of the midbrain, which is largely covered by on the either side by the cerebral crus, which is part of the cerebral peduncle. Midbrain itself is divided into two when we'll see the cross section, two cerebral peduncles. So anteriorly, what we can see here is the cerebral crus. These are the collection of the fibers, corticospinal tracts, which are connecting the cortex to the spine. In between them, there is a small space. This is interpeduncular space, which is occupied by the posterior perforated substance. There are a bunch of blood vessels which are passing through it, and just above it there are the mammillary bodies and the tuberosinium or the hypothalamus. These are parts of diencephalon, which we'll not discuss today. What we are more interested in, this is the anterior surface of the midbrain, covered laterally by the cerebral crus. In the middle, there's the interpedunclar fossa, which is occupied by the posterior perforated substance. The other important structure that is there is the arisal or the third cranial nerve, oculomotor nerve, is coming out of the interpedunclar fossa. As we can see here, this oculomotor nerve is coming from below this interpedunclar fossa. This is the diagrammatic picture of the same structures that we have just discussed. These are the cerebral peduncles or the cerebral crus in blue color on the either side. In between them, there is the interpeduncular fossa, which comprises of the part of the diencephalon, which comprises of the tuber cinereum. This is the pituitary. This is the pituitary stalk and pituitary gland. Just behind it, on the either side, there is the posterior perforated substance, this yellow in color. And just below, there is the arisal of the third cranial nerve, which comes out of the midbrain. Let's now go to the posterior or the dorsal surface of the midbrain. Now, in this, again, let's start from the bottom. This is the cut section in which we have cut the fourth ventricle. The pons medulla oblongata has been cut, and just above it, we'll see four swellings in the brain. These four swellings are superior colliculi and the inferior colliculi. These part in the green color, we can see there are four swellings. Two above, superior colliculi, and the inferior ones, the inferior colliculi. Together, they are called as the cordigemina, corpora cordigemina of the tectum. This is the tectal part of the midbrain. Also, just below it, we can see there is there's coming out another important cranial nerve, the cranial nerve number 4, that is the trochlear nerve. This is the only cranial nerve that comes out of the dorsal surface, and the only cranial nerve that is decussating within the brain stem. So this is a very important nerve, trochlear nerve, that is coming out from the midbrain just below the inferior colliculi. This is the diagrammatic picture, again to emphasize on the dorsal surface. We can see in yellow color the superior colliculi. Just below it, there are the inferior colliculi. On the either side, we can see in the blue, light blue or aquatic color, these are the cerebral crus, which we saw the anteriorly. Same we can see from the posterior surfaces as well. Now let's go into the cross section. To understand the cross section of the midbrain, let's divide it into 3 important parts. The anterior most part is the cerebral crus. It is actually the anterior part of the cerebral peduncle, and it is divided by the substantia nigra. This is just at the, we'll see in the next picture, the substantia nigra that divides cerebral peduncle into the anterior portion, that is the cerebral crus. And behind it, the part is known as the tegmentum of the midbrain. In the center, we can see a structure. This is the aqueduct of the midbrain, aqueduct of Sylvius, which carries the CSF. Any part of the midbrain behind it is known as the tectum of the midbrain. This is the tectum of the midbrain, which comprises of the superior colliculi and the inferior colliculi. So this is the picture, very busy picture, but we'll start from understanding the important structures here. So when we study about the, so this is the cross section, and when we study about the midbrain cross section, we can understand it at the 2 different levels, at the level of the superior colliculi and the inferior colliculi. So let's first focus on the picture. This is at the level of the superior colliculi. So there's important structures that we can see here. First of all, let's divide the cross section into the anterior portion, that is the crus. This is the crus portion of the midbrain that is divided by the substantia nigra. This is the middle portion that is dividing the tegmentum from the crus. This entire middle portion is known as the tegmentum, and any part that is behind the aqueduct, it is known as the tectum. The tectum comprises of the superior colliculi. The superior colliculi are important in a way. They are part of actually the part of the visual pathway, optic pathway. As we know that the optic radiations, they are going to relay onto the lateral geniculate body. From the lateral geniculate body, most of the sensations would be carried to the visual cortex. A part of the information will also be carried to the superior colliculi here, the red ones, the red structure here. Superior colliculi, the importance of superior colliculi in the visual pathway is it gives the tecto-spinal tracts, which are responsible for the movement of the neck and head along with the visual stimuli. For example, when we see any object that is moving very rapidly from one side, our head, our eyes, and our neck moves into one direction in a reflex movement. This all is the importance of the superior colliculi or this tactile pathway movement. Just below the superior colliculi, at the level below, there is the inferior colliculi. These inferior colliculi are important for the auditory pathway. This is the diagrammatic picture of the auditory pathway, and the auditory pathway, sensations would be taken the nerve through the into the cochlear nucleus in the superior olivary complex, and via it will come and lay into the inferior colliculi. From the inferior colliculi, the information would be gathered at the medial geniculate body, and then the pathway will continue to the auditory cortex. So it is the first importance of the midbrain at the level of superior colliculi. Another important structure that is arising just anterior to it, just on the either side of the, if I can show marker. All right, so this is the picture, and the left side represents the level at the superior colliculi, and we can see just ahead of the superior colliculi on the either side of the aqueduct arises there's the nucleus of the oculomotor nerve, from which the third cranial nerve will rise, and it will go by passing through the red nucleus. It will rise anteriorly, whereas on the inferior level, in the inferior colliculi, we can see here in the blue structure, this is the nucleus of the trochlear nerve, which will take a set within the brainstem, and it will come out through the dorsal surface of the midbrain. Let's discuss about the another important nuclei here in the midbrain that we can see, that is the red nuclei. Just behind the substantia nigra, these are the two red structures which actually appear red grossly because of the high level of the iron, because of the ferritin or hemoglobin. This is an important relay station for the pathway that is important for the motor function, extrapyramidal movements that is connected with the cerebellum and with the pons through the rubropontine and rubrocerebellar tracts, which are important for the coordinated movement in the extrapyramidal tracts. Now coming to the descending tracts. In the descending tracts, the most important tracts are here contained within the crus in the cerebral peduncle, in which the middle two portions, are occupied by the corticospinal and the corticonuclear tracts, which are carrying the nerve information from the cortex to the spine and to the different cranial nerve nuclei. And whereas on the anterior and the posterior portion, these are comprised of the corticopontine tracts. Anteriorly, that is the frontopontine tract. At the back, there is the occipito-parieto-temporal pontine tracts. These will be the fibers carrying the information to the at the level of the pons. So these are some important descending tracts in the midbrain, mostly in the anterior portion. And when we discuss about the ascending tracts, in the ascending tracts, there are on the here in the blue areas, these represent the important ascending tracts. So starting it with the medial lemniscus, if I can show the another picture. Okay, so this is the actual formation of the medial lemniscus. In the spinal cord, we know in the dorsal portion, these are the unitus and gracilis fibers that carry the information, sensory information of touch, crude touch, and pressure. These are carried at the level of the medulla oblongata in the nucleus, cuneus, and gracilis. From here, these fibers are carried into the medial lemniscus. And here in the midbrain, at the level of midbrain, we can see on the either side of the red nucleus, these are the medial lemniscus carrying the sensory information above. Just lateral to the medial lemniscus, these are the fibers of the lateral lemniscus, which are carrying the pressure and thermal sensations to the higher levels. Whereas at the back, we can see there is the trigeminal lemniscus, which will be carrying the sensory information from the head and neck region to the above centers. So these are some of the important ascending and descending tracts. On the either side of the aqueduct, there are also the reticular formation. These cells are shown here. These are important for carrying the reticulospinal tracts. These are important for the functions like rising and coordination of the body. Anteriorly, there are also the cerebroruberal tracts, which will be taken to the cerebellum. All right, so this brings us to the end of the important structures in the cross section of the midbrain. Thank you.
Thank you, Dr. Babar, for the great presentation, detailed anatomy. So far we don't have questions in our chat, but if question comes, we will talk about that after our second speaker. And I think